My name is Tyler. I am 31 years old. I currently live in St. Louis, Missouri, and I'm originally from Michigan. I'm a cancer research scientist doing a 5-year postdoctoral research fellowship in oncology with 1 year left to go. For the last 4 years, I've been studying MPN biology and progression. My symptoms started when I was a teenager, but I wasn't officially diagnosed with polycythemia vera until I was 26. At 17, I was diagnosed with a blood clot in my leg. It happened during my senior year of high school. I had to not play my senior year baseball, which was really difficult for me. Later in college, I had another clot in the same exact spot. I tested negative for everything the doctors were testing for, various clotting factors or hematology disorders, but no one tested for anything like an MPN. In grad school, when I was 26, I had severe abdominal pain, and they found clots in my liver, spleen, and mesentery. There were so many questions and no answers. It honestly was all just like a blur. But because of my own research and general knowledge in the biomedical science as a grad student, I knew it was serious. I knew I needed to find another doctor to figure out what was going on. My new doctor, an MPN specialist, ran a bone marrow biopsy and a sequencing panel that confirmed the JAK2 mutation. Finally, I was diagnosed with PV in 2021, almost 10 years after the symptoms had started. There's a lot that you don't expect to happen when you're 26, and being diagnosed with a cancer is certainly very high on the list. I was graduating with my PhD in biomedical science at the time, and there was a lot of decisions that I had to make and me and my wife had to make. And I definitely was hearing advice and people telling me maybe you can't keep up with what this career is going to be asking of you at the next stage with all of this going on. But I wanted to be in control. I started with phlebotomies alone to keep my blood counts in normal ranges. It was taking 3, sometimes 4 phlebotomies a month, which is of course not sustainable. And so then we switched to other options. The first treatment, I had really bad bone pain and joint pain. It took me out of sports. It stopped me from being able to walk the dogs without pain, do lawn work. It really took me out of my normal life. I transferred to start my research fellowship in St. Louis in 2021, which coincidentally is the year that BESREMi was approved. And after talking with my physician and seeing the side effects that I was having with my current medication, we made the switch. BESREMi has effectively kept my blood counts down. I have only needed 3 or 4 phlebotomies in the last 4 years, which is a significant decrease from needing 3 or 4 per month. BESREMi has allowed me to get back to living my life. It's allowed me to play sports again. I even hiked Rocky Mountain National Park just a year after starting on it. When I first started, I had very minor joint pain and bone pain, but that was easily managed with ibuprofen. My doctor explained the potential side effects of interferon since they put your immune system in overdrive. You may get some flu-like symptoms and some bone pain, which I did. But for me, it wasn't a concern. BESREMi felt like an upgrade. The injection experience really isn't that bad. My wife is a nurse practitioner and she helps administer them. We do it every other week. Advice that I always share with people when they're first diagnosed is that you have to be in control of the things that you can be in control of. Find a good doctor who knows PV, and that's always step 1. Don't let worst case scenarios consume you, and can control what you can control. Your next steps, your schedule, your goals. Try to stay objective. I also rely on the MPN Research Foundation community. It's a weird space to be in, rare cancer, but in a chronic phase. Finding people who get the balance is good for your head. It's really jarring. When I first was reading about MPNs and possible treatments, I didn't see a lot of people who looked like me, younger. But we think differently. What does it look like 40 years from now? We want to know how to stop this from getting worse and progressing, not just managing symptoms. People told me I may need to consider giving up such a demanding career, that I couldn't keep up. I didn't listen. If anything, it made me double down on my career in cancer research. I refused to let cancer stop me from studying cancer. Before switching to BESREMi, my days were sometimes cut short by fatigue or headaches. But after switching to BESREMi, I was able to get back into control of all of those things, and my disease has become much less of something that interjects into each of my days and more something that I have control of.
Read this important safety information carefully. It explains the serious risks of BESREMi and how to take it safely. Talk to your healthcare provider if you have any questions. What is the most important information I should know about BESREMi? BESREMi can cause serious side effects, including conditions that may cause death or may worsen certain serious diseases you may already have. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking BESREMi permanently. These symptoms may go away in some people after they stop taking BESREMi. Mental health problems, including suicide. BESREMi may cause mood or behavior problems that can get worse during treatment or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, hopeless, or bad about yourself, unusually grand ideas, acting aggressive or impulsively, thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, call your healthcare provider immediately. New or worsening autoimmune problems. BESREMi may cause your immune system to attack healthy cells, leading to conditions such as thyroid disease, increased blood sugar, hyperglycemia, or type 1 diabetes. Call your healthcare provider if you experience extreme tiredness, frequent urination, excessive thirst. Heart problems. BESREMi may cause heart problems, including cardiomyopathy, heart muscle disease, heart attack, irregular heartbeat, atrial fibrillation, decreased blood flow to the heart. You should not take BESREMi if you have uncontrolled high blood pressure, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, a recent stroke or heart attack. Who should not take BESREMi? Do not take BESREMi if you have or had severe mental health problems, especially depression, suicidal thoughts, or attempted suicide, have or had a serious or untreated autoimmune disease, are allergic to interferon or any ingredient in BESREMi. Symptoms may include itching, swelling, trouble breathing, dizziness, or chest pain, have certain types of liver disease, have had a transplant, and take immune-suppressing medication. Before using BESREMi, tell your healthcare provider about all of your medical conditions, including if you have any of the following: a mental illness, type 1 diabetes, heart or bleeding problems, problems with your immune system, hepatitis B or HIV infection, kidney or liver problems, are pregnant or planning to become pregnant. BESREMi may harm your unborn baby. Use effective birth control during treatment and for at least 8 weeks after your last dose. BESREMi may affect your menstrual cycle and could stop your periods. Do not breastfeed while taking BESREMi. What are the possible side effects of BESREMi? Serious side effects include low blood cell counts. Taking BESREMi can lead to infections, anemia, or bleeding problems. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nosebleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue, or throat, trouble breathing, chest pain, or feeling faint. Eye problems. BESREMi can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with BESREMi if you have diabetes or high blood pressure and also have retinal problems. Liver problems. BESREMi can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with BESREMi. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with BESREMi. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, swelling in your ankles, blood in your urine, or loss of appetite. Tooth and gum problems. BESREMi can cause tooth loss and/or dry mouth. It is important for you to brush your teeth well, 2 times each day, and have regular dental examinations during treatment with BESREMi. Skin reactions. BESREMi may cause reactions such as rash, itching, and hair loss. Increased triglycerides. You may require blood tests to monitor levels. The most common side effects of BESREMi include flu-like symptoms, including tiredness, weakness, fever, chills, muscle aches and joint pain, itching, sore throat. These are not all of the possible side effects of BESREMi. Call your doctor for medical advice about side effects. You may report side effects to Pharma Essentia at 1-800-999-2449 or FDA at 1-800-FDA-1088.